What was that, Chris?
Who's with you, Robert? I'm sorry.
Oh, let me introduce Joni LaVille. She's our new field rep here at the GFT. And
Good morning,
a big asset to our team. So looking forward to the opportunity to shine a light on her today.
Right on. Tim, thanks for joining us as well.
Thank you for having me. Appreciate it.
So let's just get right into it then. Are there any concerns, issues that the Guam Federation Teachers has with this executive order vaccine mandate that was released by the governor late Friday afternoon?
Well,
Tim?
yeah, well, you know, I don't know. It's a tough one, Chris. It really is. I mean, I believe people should be able to form their, I believe people should be able to do take a vaccination if they want. If they don't, it shouldn't be forced upon you. I don't like it when government forces people to do things to their body that they don't want, right? That's a scary situation, society, so to speak, you know, what's next, you know, all those conspiracies. But that being said, I'm fully vaccinated. I think I'm not worried about the vaccine. I think the vaccine is helping us prevent more deaths. And, you know, as a teacher, kids are now getting the vaccine, and teachers always love their children so much and care so much for them. Getting vaccinated will protect them. So it's a very tough situation. I mean, we have to take a TB test every year. I mean, just to see if we have tuberculosis. And yet the students don't take the TB test every year to see if they have tuberculosis, and tuberculosis spreads. I mean, so the idea is to get everyone safe, but I don't know if it's working. I mean, we're going to mandate everybody, government employee, take the vaccine, but yet we allow the airports open for everyone to come in. I mean, if you know, Guam's hit the 80%, and we wear our masks. We're not like the States. We're not protesting wearing our masks and things like that. We're doing everything we can. I don't necessarily see how this is really going to change anything. Most of the firemen I've talked to said 80% of those guys are vaxxed already. A couple that I did, you know, teachers, I have talked to some that don't want to get it. And what is the real question is possibly, what if we do lay off all these firemen, or furlough, or fire, or take disciplinary action against policemen, firemen, DOC guards, and we're down to 50% of the workforce in there? Then are we creating a more dangerous society by trying to make a healthier, safer society, right? So these are, you know, I'm not the governor, and I don't plan to be, but these are tough decisions, right? You know, very hard things to do. And I think when you force people to do things, they have pushback, right? I'm not going to do it. It's my right.
Yeah.
You know.
Well, we've tried everything, Tim. I mean, we give away $10,000 and a brand new car. You know what I mean? We incentivized the herd immunity, and we told the island of Guam that if we got the herd immunity, then we would enjoy less restrictions. And that's exactly what we did. But now we're going to be enjoying fewer restrictions. But I wanted to ask, because with GDOE specifically, right, we got the word from the superintendent that we're talking about maybe 1,000 employees who have not received the vaccine.
Yeah.
And it kind of sounds like you're pretty conflicted, Tim, personally, but is there an official stance with GFT, or is it going to be case by case? Have you heard from any members over the weekend?
We have heard from some members over the weekend when we were doing the TB testing at the office. And one of them said that they will probably no longer teach if they're forced to get the vaccine, because they are deathly afraid of affecting an elderly person that they live with. We're short teachers, and we could have a mass shortage if more people feel that way. And there were quite a few people at that person's school who were not vaxxed and definitely against it, and asked my stance on it. And my stance is people should be willing to get vaccinated, but not forced to get vaccinated, right? I mean, the encouragement on polio vaccine back in the day didn't have herd immunity because everyone did it. And guess what? Polio's gone, right? I mean, I see the apprehension because it's emergency certified, but from the news, it sounds like in a few weeks it will be certified by FDA as a fine and healthy vax. But people are apprehensive, you know, and everyone has a different situation. And if you have a doctor's excuse, they can't make you get it, right? Cancer survivors, those kind of people may not be being vaccinated for that reason. Do they deserve to lose their job? Absolutely not.
Robert, good morning.
Good morning. Yeah, we've heard quite a bit, actually, probably more feedback on this issue from the membership than anything else that's ever come forward. I've literally just blown up my phone day and night. You know, some of the things that we have heard is the concern that the vaccines have not been approved. And there's only an emergency authorization by the FDA. I went to the FDA website to verify that, and it's true, they have not approved it. They admit they're under tremendous pressure from the government to approve the vaccine, but they also stated they wouldn't compromise the integrity of their work, and that they would, you know, approve it when the time comes. They did not offer any date for when that approval may come, and yet we hear politicians saying any day now the FDA is going to approve it. Well, I don't know how much pressure they can put on the FDA, but that's kind of contrary to their website, where they're saying we'll approve it when it passes the test. And then I understand that there was the control group used in the experiments by the FDA, or whoever conducts the experiments, was notified that they were given placebo. Some of them went out and got the vaccine, and that kind of messed up the testing process for them. And so they've got their own issues on their side to deal with. And so what we have is a government mandate to put an experimental drug into your body. Okay, so this is where we start getting a little concerned. Lots and lots of different feedback and feelings about that, but as you know, many of us don't trust our government. And so we try to use logic and say, well, let's follow the medicine and the science and not the politics. When we do that, I talk to our nurses, every one of them, 100% advocates for the taking and the use of the vaccine. No question about it on their side. On the other side, we've got many, many employees who are concerned about using an experimental drug that has not been approved, and whether the government is properly authorized to force us to be lab rats and inject the experimental drugs into our bodies. You know, we've heard about heart disease and aneurysms and things like that associated with it, but we don't know yet. Where was the one about the lab rats? We should not be forced until it's approved. What was one for that? Okay, well, some have inquired about, I see, religious exemptions. You know, that's one that we haven't raised yet. Yeah, you know, I think the government might have got their cart in front of their horse. Also, this business of giving a $10,000 prize or a new car, even discussions about paying people to take it. For a lot of people, that seems like too much. Why is there so much motivation? And what is the long-term impact? If they can now force us to take experimental drugs, can they force us to install nanobots in the future?
Wait a second here, Robert.
What about, you know, the executive order also says, though, that if you don't get the vaccine, you will be required then to test for COVID every week. And if you don't get the vaccine, you don't take the test, then you'll be subject to disciplinary procedures, which includes disciplinary action. May include.
Disciplinary action in the government of Guam is progressive. It's adverse action. It's suspension, demotion, or dismissal. So what they're saying now is coercion. We'll do everything within our power to force you to do it, including fire you from your job if you don't. So that's pretty convincing. You know, we have a number of employees who said, "I won't work for the government of Guam. You know, let them fire me, but I'm not going to take the test." We got others who said, "Looks like we don't have any choice. We're being forced to do it." You're being forced to do something, that's coercion. Generally, we try to shy away from coercion. We frown on coercion. We overturn cases where coercion is a factor. So, you know, these are all things that suggest that maybe what's happening isn't really, maybe a little bit of a strong arm, you know, that probably not the way to go. Let's see. You want to hear from the place? I wrote down from my chat group some of the, without trying to be too repetitive, but most feel they should not be forced to take the vaccine. They should be asked their permission. Help me with it. Jody, you want to read the next one?
Okay. Will the government give them leave to get the vaccine? If it's an employer requirement, then they should give them leave.
Okay, let's stop there. I just saw the announcement from Public Health, and they have a morning session on Mondays and an afternoon session on Fridays up in the north. But it all wraps up by 5 o'clock. So if you're working 8 to 5 GovGuam, you know, I think the question is, will my employer allow me leave to go take the test? And we don't know. Some might not. Some might give you administrative leave or excuse you without charge to leave. Others might require you to go take sick leave while you get your test. I don't know. We hope that the government will accommodate them. Next one was retirement or suspension due to. Oh, okay. Yeah, the GPD is a good example, an agency and maybe DOE as well, where if there are large losses of personnel or even small losses of personnel, these agencies may not be able to handle it. I know GPD is a critical staffing pattern, and to lose employees because they didn't get tested might not be an option for them. Military. United States military is not requiring service members to take the vaccine until the FDA approves it. So that's the argument that I was putting forward in the beginning. It ought to be an approved drug before anybody's requiring anybody to take it. The only example I can think of is, I think there's some LSD testing back in the 60s with experimental drugs. Probably turns out now we look back and that maybe not a good thing. So, yeah, making sure it's approved is a reoccurring theme. Is it safe? Is the government endangering our health and safety? What do we got?
Put something into your body, experimental. You're going to refuse it at whatever cost.
Okay, so we have some to say I'll refuse no matter what it costs me or my family. So there's going to be those guys. You know, there are going to be some out there.
Hey, Robert, what about nationally? I got eyes on an article out of Forbes. Teachers Union president backs vaccine mandates for educators, but Biden administration declines to go that far. And we're talking about the American Federation of Teachers.
Right. So we're going to go with politics?
No, I'm just asking.
Yeah, American Federation.
Randy's against the mandatory vaccines, but she's also saying, let's look into it. So she's kind of on the fence with it as well, right? You know, it's a tough decision. It really is. I mean, to force people and the basic, I think everybody's trying to keep everybody safe, right?
Hey, Tim, real sorry. Can I get you to turn on your camera? Sorry, this is Jason at KUN. Yeah,
Okay.
your camera's off.
Yeah.
Yeah, apologies.
Rod,
Sorry.
let me ask you, right? So we're talking about disciplinary action, and I know you got a lot of experience at the Civil Service Commission level, but in your opinion, and if you read this EO, they tacked on about a page of different court cases that I guess they feel set precedent or justify this type of action. But appealing something like this to the Civil Service Commission, do you think that it would hold up at the CSC level?
Well, I think, as we look through the court cases, one of the things that's missing is discussion about non-approved. The fact that the vaccine has not been approved, and there's just not being talked about. And so, maybe there's some research done, but I don't think it's exhaustive at this point, because it was not approved as experimental. They're still going through testing to try and learn what are the side effects, what are the dangers, what are the risks to our health? And we don't know that yet. So, yeah, we know that we require TB testing. Tim brought this up earlier. In fact, GFT participated in helping people meet their government mandate to be tested for TB annually. So, it's out there, it exists, this is nothing new, but the TB issue is not experimental, it's approved. So if we follow that model, let's get this approved before we start forcing it on people. I just want to know it's safe. Full disclosure, I have not been vaccinated. And I feel great. And against a disease that most people don't even know they have. My favorite kind of disease, I don't feel it. It doesn't make me sick. So anyway, there you go. I will get vaccinated once it's approved, and I know that it's safe to do so. But right now, I don't know what the possible consequences is. No more babies? Who knows? I'd like to know that it's safe before I get vaccinated. And shoot, if the government wants to give me $100 to do it, that's even more motivation. But again, we don't want to follow the politics. We want to follow the science.
Well, I got a message from Dr. Hoa from the Physician Advisor Group this morning. And I know you mentioned this FDA approval, but he said Pfizer expects to be fully FDA approved by early September. Moderna also soon will be fully FDA approved. When that happens, do you guys then feel like this mandate will be bulletproof?
Yeah, then I think you would have. I think they got the cart before the horse. If they would have waited for that, I think the issue would have been a lot less. Created a lot of anxiety for our members.
So one of our members just chimed in and said, you find your teachers and your nurses are very liberal in their ways of thinking, while your law enforcement officers are generally very conservative. And it seems to be the conservatives who are, holding back while your liberal thinkers are moving forward with the mandate. So, that's an interesting observation. Another one just came in and they talked about the long-term effects need to be studied. If it has adverse effect on our future or our children, we won't know. And so there's that as well. And I know there was hesitancy to give the vaccine to the children, at least initially. So that's an interesting point to raise as well. Just during this conversation, these two comments popped up. We have follow medical advice versus political advice. Okay. Local docs and the government have earned their reputation that they can't be trusted. So that I think is a big deal. Our government, are they in the business of, keeping the people safe? Because, I think there is a lot of trust issues involved with our government, and then that might be, a big part of it. I've heard rumors that the hospital gets paid to declare deaths due to COVID. And, we have this comorbidity where a heart attack was complicated by the COVID virus. And, we don't know. We're not there. But we don't trust the source. Now, Chris or Sabrina were to say it, we would know it was true.
Yeah, we haven't
Right.
said it, so there it is.
But you haven't said it.
Right on. Okay, good. Obviously, this is going to be developing. I'll shoot you guys a message later to see what other kind of comment you've gotten from the membership.
Right, and then try to navigate that. How do we best serve our members, particularly when they're very split on it? Like I said, there's no doubt in the mind of the nurses that the vaccine is the way to go.
Right.
I myself am just waiting for some kind of assurance from the FDA. And then, of course, many say they won't work. They would rather be fired from their jobs than have to take the vaccine.
Well, there's going to be a lot of people looking for a job come September.
Well, I think there's
Yeah,
already-
that's easy. That's easy to say though, but a lot of times you have to be certified and go to
Right,
school.
yeah,
It's not
yeah.
like, you know what I mean? You
Of
can't
course.
just pick up anyone off the street to start
Yep.
being a police officer. You can't pick anyone up to start putting out fires.
Of course.
It's a little different.
Yeah, totally.
And the low-paying jobs are easy to replace. You get fired from a $10 an hour job, no worries. Tomorrow you'll have another one. You know, the low-paying jobs aren't a big deal. And a lot of jobs are low-paying, buddy.
That's a whole other show,
Yes.
Robert.
Yep.
Thanks, Tim.
Thanks, Jovi.
Thank you.
Thank you, Jovi. Way to break a leg on your debut. We'll see you. Bye. Thanks. There you go. Guam Federation of
Stay
Teachers,
safe, everyone.
represented by field reps.
And we're going to keep on moving on with our newscast now. As you heard earlier, on Friday, senators passed a pair of bills to remove any and all impediments they believe will allow the governor to pay the all-rise stimulus payments to eligible residents. Prior to passage, several senators voiced their frustration with the governor not providing the